Hey there! Welcome back to Healthy Women channel. Today we're diving into a topic that many of you have been curious about: sex during pregnancy. I know it's a topic that comes with plenty of questions, and guess what? We've got the answers. Whether you're an expectant parent or just curious about what to expect, this video is here to provide you with all the insights you need. So grab a cozy seat, and let's get talking about the wonderful world of intimacy during pregnancy. Is it safe to have sex during pregnancy? This question echoes through our website like a common thread, and believe me, you're not alone in wondering about it. The answer is yes. In most cases, it is safe to have sex during pregnancy. However, it's important to consult with your healthcare provider to ensure there are no specific concerns or complications. Generally, if you have a healthy, low-risk pregnancy, sex is considered safe throughout all trimesters. The baby is well protected by the amniotic sac and the strong muscles of the uterus. However, there may be situations where your healthcare provider advises against sexual activity, such as if you have a history of preterm labor or certain complications. It's essential to have an open and honest conversation with your healthcare provider to address any concerns or questions you may have. Could having sex harm the baby? Yes, it's one of those frequently asked questions that pops up on our platform time and again. And you know what? It's fantastic that you're seeking answers and looking out for your little one. And the answer is, no, it is highly unlikely that sex will harm the baby. The baby is well protected within the uterus, surrounded by the amniotic sac, and the cervix is closed to prevent any harm. Additionally, the mucus plug acts as a protective barrier. Sexual activity, including intercourse and orgasms, generally does not pose a risk to the baby. However, if you have specific concerns or complications, it's best to consult with your healthcare provider for personalized advice. Will sex feel different during pregnancy? Many women experience changes in their sexual desire and physical sensations during pregnancy. These changes are normal and can vary from person to person. Some women may notice an increase in libido due to hormonal changes, while others may experience a decrease in sexual desire. As your body undergoes physical changes to accommodate the growing baby, you may find that certain positions or activities that were once comfortable may feel different or less comfortable. It's important to communicate openly with your partner about your needs, desires, and any discomfort you may experience. Exploring different positions and finding what feels best for you and your partner can help maintain intimacy and pleasure during pregnancy. Are there any positions that are safer or more comfortable during pregnancy? Yes, certain positions may be more comfortable during pregnancy. As your body undergoes physical changes, you may find that some positions that were once comfortable may now cause discomfort or strain. Here are a few positions that many pregnant individuals find more comfortable. Spooning. Lie on your side with your partner behind you, both facing the same direction. This position can provide support and minimize pressure on your belly. Woman on top. You can try being on top, allowing you to control the depth and pace of penetration. This position gives you more control and may alleviate discomfort. Doggy style. Remember, the most important thing is to find what feels comfortable and pleasurable for both you and your partner. Experiment with different positions, use pillows for support, and communicate openly to ensure a positive and comfortable sexual experience during pregnancy. Can orgasms trigger contractions or premature labor? This question is asked again and again, and the answer is that while orgasms can cause uterine contractions, they are typically harmless. Orgasms during pregnancy do not usually lead to premature labor, especially if the pregnancy is progressing normally. The contractions that occur during orgasm are known as Braxton Hicks contractions, which are common and usually mild. They are the body's way of preparing for labor. However, if you have a high-risk pregnancy or a history of preterm labor, it's essential to consult with your healthcare provider, as they may advise against or modify sexual activity to minimize any potential risks. What if I experience bleeding or pain after sex? If you experience any bleeding, pain, or unusual symptoms after sex, it's important to contact your healthcare provider. Although these symptoms are often harmless, they can sometimes indicate an underlying issue that needs medical attention. While mild spotting after sex can occur due to increased blood flow to the cervix, it's always best to consult with your healthcare provider to rule out any potential complications. They will be able to evaluate your specific situation and provide appropriate guidance and recommendations. Is it safe to use sex toys during pregnancy? Using sex toys during pregnancy is generally safe, as long as they are cleaned properly and used with caution. However, it's advisable to consult with your healthcare provider or midwife for specific recommendations. If you choose to use sex toys, ensure they are made from body-safe materials, easily cleaned, and do not cause discomfort or irritation. It's important to communicate openly with your partner about your desires and comfort levels when incorporating sex toys into your sexual activities during pregnancy. What if I have a low sex drive during pregnancy? Many women experience changes in their libido during pregnancy, and a low sex drive is not uncommon. It's important to remember that this change is normal and can be influenced by hormonal fluctuations, physical discomfort, or emotional factors. If you're experiencing a decrease in sexual desire, open and honest communication with your partner is key. Discuss your feelings, concerns, and explore other ways to connect intimately that may not involve sexual intercourse. Non-sexual physical affection, such as cuddling, kissing, and massage, can help maintain intimacy and closeness during this time. If the decrease in sex drive becomes distressing or affects your relationship, consider discussing it with your healthcare provider or seeking support from a counselor or therapist who specializes in sexual health and pregnancy. When should I avoid sex during pregnancy? In some cases, your healthcare provider may advise against sex during pregnancy if you have a history of preterm labor, placenta previa, where the placenta covers the cervix, or if your water has broken. It's important to follow your provider's recommendations and discuss any concerns you may have. If you experience vaginal bleeding, have a history of miscarriages, or have been advised to avoid sex due to other complications, it's best to abstain from sexual activity until you receive clearance from your healthcare provider. Always consult with your healthcare provider for personalized advice based on your unique circumstances and medical history. Remember, every pregnancy is unique, and it's important to prioritize your comfort, safety, and open communication with your healthcare provider and partner throughout the journey. And there you have it. We've covered the most burning questions you've had about sex during pregnancy, from whether it's safe to concerns about the baby, and all the way to addressing discomfort or changes in desire. We've got you covered. Remember, your journey as expectant parents is a remarkable one, and it's all about finding that balance that feels right for both of you. We hope that this discussion has brought clarity and comfort to your minds. If you found this video helpful, don't forget to give it a thumbs up and hit that subscribe button below. By subscribing, you'll be joining our ever-growing family of curious minds, seeking knowledge and support on all things related to women's health and beyond. Thank you for being a part of this conversation, and for allowing us to be a part of your journey. Remember, you're not alone in this adventure, and we're here to support you every step of the way. Until next time, take care, stay informed, and keep those smiles shining.